So what are the advanced incubators you are using, ma'am? Like you need to mimic the environment which has been made by God in the human body. You need to mimic them in the laboratory. So how do you manage that?
So in the lab, the HEPA filters are there. So that filter that is a negative pressure in the lab, what is that? It will go off. Laminar airflow, that also the pure air we will give. With that, we do that.
How do you maintain the laboratory? It needs to be completely sterile without any contamination, any microorganisms like nanoparticles also should not be there. So how do you maintain them?
Exactly, it is a good question actually. Every procedure we clean the lab. Once the OM become is done, so all blood fluid, follicle fluid, everything is taken and we'll clean the lab very thoroughly with the oosafe solution what we are using, the disinfectant that we will clean thoroughly. And after that also if HbSCG patients also, that what minimum instrument what we are needed, that only is kept in the laminar airflow. So after once the procedure is done, we'll clean the lamp thoroughly and keep very sterile.
You are working with something you can't even see with your naked eye. So it's not so easy that you can open the microscope and you can see everything you are talking about. So how do you feel about that, ma'am? And anything tough in doing that job?
It is not stuff. Yesterday night only my son was asking something. I was just reading some papers, research papers. So he was all, Mama, how the sperms are very, you can see what I told no. Then he took a pen, he put a dot on the paper. So much it will look. Nana, we can't see with the naked eyes. We have to see under the microscope and it's very micro particles, that means it is. So we can see under the microscope only. So he is very passionate. Mama, when I'll come to your lab, can you show me how the exam? Because when he will see in the reels only, means whatever, when he'll scroll or something he will see some, because I will in my mobile I'll just some research papers or some in the WhatsApp the research paper is uploaded and all that, na? He will ask me multiple questions. So I'm very interested in, means I want to teach the people what is going in our lab. So for friends also when I'll meet, then I will tell, they will tell every time you will talk about their lab only or because I am very passionate about this. So I want the people to know what we are doing actually in the lab, that what is done in the human body, that we are doing actually in the lab, that is good for the people. Few people don't know what is IVF, what is ICSI and everything. They know only test tube baby. Test tube baby means what? The test tube, the advanced technology has been done. There are different technology has installed. So the people has to know the difference between the test tube baby and ICSI and PICSI and everything.
So what is the real difference, ma'am, according to lab? So we know about the clinical perspective, but according to the lab perspective, what is the difference?
If the sperms and oocytes have some abnormalities, so natural pregnancy is impossible. So only the people come for the fertility center for the procedure. So we are doing our best. So patient consultant, the doctor says all the circumstances, what is good to the patient, what the factors they have to take the steps and everything. If the sperm is not good, so we use advanced technology like Zymote, CA0 for the improvement, better improvement. If the count motility is good but morphological is not, this technology will use to selection of the sperms. The same as the oocyte quality is not good, so madam will suggest some medicines to the patient so that oocyte quality better quality we will get and we can do ICSI. So with that we can give 100% to the patients.
What are the advanced techniques or equipment you are excited for coming into the industry?
So recently I have known that in thawing and freezing, there means now we are taking with some kind of thawing has a 10 minutes procedure. Now in 1 minute only that procedure might complete. Like that technology is coming, and freezing also the research is going on that yet has to come in the market also. So with this technology we can give a minimum time consuming also is for us also for doing this all process.